In this 3D scene, we can see the thoracic vertebrae at different levels, with vertebrae from transitional regions named T1 and T10, and typical thoracic vertebra, which is T5 in this case. So let's start with the typical thoracic body, vertebral body, that conventionally has this heart shaped from superior perspective. And we can see, if we move towards the upper level, that the diameters and dimensions are going to change from upper to lower levels. And that's the reason of this characteristic shape, which is due to the increase on the surface of the end plates, mainly the increase on the anterior to posterior dimensions, and later on inferior levels there's a general increase on the dimensions, acquiring more lumbar morphology. If we move posteriorly we see the pedicles. This is outlined as number 2. So the pedicles are gonna have initially a more oblique projection, and then are gonna tend to get stronger and have a more parasagittal projection on inferior levels. And that's also gonna modify the spinal canal or the vertebral canal, in which we see that it tends to be smaller and more rounded on inferior levels compared to the superior ones. Some of the characteristics of the thoracic vertebral bodies is that they have demifacets, which serve as articulations with the ribs, at least the most medial articulations with the ribs. There's a superior and inferior demifacet on a typical thoracic vertebral body, and there's another lateral articulation, which is the costotubercular facet, which lies at the anterior aspect of a transverse process. So we can identify again superior and inferior demifacet on T5, as well as demifacet, a superior demifacet of a more that resembles the superior demifacet of T5 on T1, and a very small inferior demifacet again on T1. If we move towards L5, we can identify again a superior demifacet and identify an inferior demifacet that has a smaller surface compared to T5. Now, seeing the transverse processes, we see how the transverse process of T1 has a more superior projection, whereas the transverse process of T5 has a more horizontal projection. It tends to get broader and shorter. And if we move towards the inferior level, we see that it goes considerably shorter and also thicker. Now, identifying the laminae and the pars interarticularis, we see that the lamina of T1 has a more horizontal projection, whereas the lamina of T5 tends to get shorter and have a more vertical projection. And when we visualize the laminae of T10, we see that it's really short compared to T1. The superior and inferior articular processes on all at different levels tend to be or to have a more vertical projection, and they're usually are matching the superior and inferior segments, as we can see again from T1 that tends to go a little bit more anterior, and see on T5, and again T12, T10, and identifying the most posterior projection, which is the spinous process. At an inferior level, we see that the spinous process gets shorter and have a slight posterior or horizontal projection, whereas in this typical spinous process of the thoracic region, we see that it tends to be has a long projection and runs in a more vertical fashion. And we see T1 that has a long spinous process and has a more horizontal projection. Let's remember as well that sometimes this tends to get even a more posterior projection than C7. So that's the overview of the different morphology of the thoracic vertebrae. This is a dissection exposing the right side of the mid-thoracic region from superior to inferior, and again left side and right side, medial to lateral. What we're seeing superficially are the first layer of dorsal muscles that are associated with the spine. We see the supraspinous ligament, and in a deeper layer we see the interspinous ligament. We can identify the spinous processes that have a vertical projection, and the laminae of this right side with a very, very small space between the laminae. We also see the transverse process, and if we remember, the transverse process has a facet for the articulation with the body of a rib, and this facet in between we're going to find a costotransverse ligament. After removing the lamina, we can expose the dura mater, and we also expose the dural sleeve of the intercostal nerve root. We see that the nerve root has a dorsal and ventral rami, and that the dorsal rami is going to travel over the superior edge of the rib. Anteriorly, we see the costal demifacet, and we also see the interbody space with the intervertebral disc. We can identify the bodies, and anterior to that, we can also identify the pleura. This is a posterior view from superior to inferior, medial to lateral. We can visualize the superficial trapezius muscle that is attaching to the upper thoracic and cervical spinous processes, as well as the latissimus dorsi muscle that attaches to the mid and lower thoracic spinous processes. After removing the superficial muscles, we can expose the lamina, visualize as well the transverse process and its articulation with the body of the rib, the dorsal rami running over the superior edge of the rib, and in between these ribs we can observe the intercostal muscles that are muscles that help for the respiratory function. We can again identify the costotransverse ligament. It's a ligament that lies just at the joint between the anterior portion of the transverse process and the posterior portion of the body of the rib. A close-up view, superior, inferior, medial to lateral, from deep to superficial, the pleura, the intercostal artery. The intercostal arteries are branches that originate from the thoracic aorta from the 3rd to 11th segments. The thoracic aorta lies at the mid left parasagittal portion of the vertebral body, meaning that the right intercostal artery has a longer course compared to the one in the left side. We can also see that the intercostal artery travels along with the intercostal nerves that, as we mentioned before, are going to be traveling over the superior edge of the rib. We see the transverse process, the inferior articular process, superior adjacent articular process, the zygapophyseal joint, lamina, the intervertebral foramen being exposed, the vertebral bodies and interbody space with the disc, and of course the spinous processes with their respective ligaments.